prior studies demonstrated that metal toxicity often interferes with homocysteine metabolism, so that elevated homocysteine also becomes a marker of metal toxicity. The metals that we're talking about are commonly known toxic metals such as lead, cadmium, arsenic, but also essential metals like copper can become toxic, particularly in women, because the estrogen hormones promote the retention of copper in the body. I am Dr. Arnold Iser. I am a researcher affiliated with the Center for Excellence in Environmental Toxicology at the Perelman School of Medicine of the University of Pennsylvania. And I am talking about an article that will be appearing in the Mayo Clinic Proceedings this September. It is entitled Hyperhomocystinemia is associated with a myriad of age-related illnesses, a potential role for metal toxicity. And this is the result of a research collaboration with two Norwegian scientists, Dr. Tone Olsen and Dr. Helga Rek, who are in the Department of Nutrition at the University of Oslo Faculty of Medicine. So we collaborated our efforts of environmental toxicology and nutrition because hyperhomocystinemia involves both components and is involved in many diseases impacting senior citizens. These include Alzheimer's disease, Parkinson's disease, stroke, cardiovascular disease, renal disease, peripheral vascular disease, atrial fibrillation, macular degeneration, and deafness. All of these diseases are accompanied by an elevation of homocysteine in the blood. And this is an amino acid which is metabolized product. But at high levels, it becomes both neurotoxic and vascular toxic. So its level needs to be measured and controlled. Now, in the past, this was done primarily with vitamin supplementation, vitamins B12, folate, and pyridoxine. When homocysteine is found to be elevated, it's not only necessary to either provide or check the vitamins, but also to do a toxic metal screen, which should include not only blood and urine specimens, but also often nail or hair samples as well, because these metal toxins may clear the body out of the serum and the urine, but still be in the body, so that hair or nail analysis may become necessary. So the potential to either prevent or treat these diseases that I mentioned, which are, as you know, quite common in senior citizens, but also many other diseases that are characterized by elevated homocysteine, means that now when elevated homocysteine is found, a toxic metal screen needs to be done too. That this can drastically reduce the impact of aging if we can address this particular issue. It does require additional clinical research to see what are the most efficacious interventions in treating these toxicities, but many of these treatments are already well known for many years, but have not been applied because the screening has not been done. Please take the opportunity to read the article in detail, because it gives much of the background and evidence of why this is so important and how the interaction between environmental toxins and nutritional deficiencies can play an important role in the development of a number of serious disorders that afflict the older population. And the potential to prevent these disorders is substantial. Thank you for your attention.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.